My name is Victor Petreca. I am a faculty member at Boston College. I'm currently an assistant professor at the Cornell School of Nursing. My setting, more specifically, has been forensic or correctional facilities. I think we have included so much of clinical language into our regular vernacular. For example, now people will say that they are depressed instead of saying that they're sad. And more recently, I think we saw the expansion of different diagnostic groups, such as autism spectrum disorder. Since the new DSM, the whole category was shuffled. What we used to call autism spectrum disorder or identify as autism spectrum has been very much changed. And in some cases, that's beneficial, but in some cases, the diagnostic inflation can be harmful as well. So as we think about diagnostic inflation, we cannot detach that from social media. It's not uncommon for us to see patients that will come with the full diagnosis already taken care of based on some type of quiz that they have done online. And in many cases, they are not really seeking an assessment, but they might be just asking for a validation. And the concern is that some of these diagnoses, they have somehow become reframed away from being a diagnostic instrument that we use to provide care, but it's become something that people use as a way to identify themselves. But when we are conflating things, that can become an issue because we have limited resources. And if it is a scenario in which we have to sort out who needs to be accessing outpatient, inpatient, partial, various levels of care, and those are largely diluted because of this process of self-identification with diagnosis. One of the main findings was that diagnosis is increasingly being used as an identity and not just as a clinical tool. So many people now will use diagnoses like autism, ADHD, or even trauma-related disorders as frameworks to explain themselves rather to describe functional impairment. Another main finding was that two forces have been happening at once. There's the legitimate diagnostic expansion that we have been as a healthcare or psychiatric community being diligent to reevaluate so we are not letting people fall through the cracks. But at the same time, we are lowering the threshold so much that ordinary variation is being labeled as a disorder. And, I don't want to go into the tangent, but sometimes when we start lowering that threshold, then are we potentially discouraging folks to adapt or to even enhance or optimize their ability to overcome challenge or to grow through different adversities? The literature review also showed that digital culture is a major driver on the diagnostic inflation and that we have real consequences for psychiatric nursing. Once we see assessment validity becoming harder, then can impact our ability to develop therapeutic alliances because those can become more fragile, especially if we are disagreeing or maybe challenging notions that patients may have as they come to us. In some instances, we might not be affirming the diagnosis that do not meet criteria. And then we also have diagnosis increasingly pathologizing normal adaptation and coping. And the review also highlighted that as nurses, we need a new framework to balance identity and clinical need. So how can we welcome those patients who may have situations in their lives that impact how they perceive themselves, but maybe it's not impacting their functioning and not make them feel that we are disregarding their experience. And I think it's important to mention that by no means the diagnostic manual and the criteria that we have are perfect, but they are the only tool that we have available at this point. As nurses, I think we are socialized to be caring, which is obviously a good thing, and to empathize and connect with patients. And sometimes teasing through the situation and educating patients that what they perhaps identify as is not clinically appropriate, accurate, or relevant, that is part of caring in itself. So I think as nurses, we are so concerned about disappointing patients, but sometimes helping to correct the narrative and to just flesh out what is disorder and what is narrative can be incredibly therapeutic.